The gastric bypass is the oldest bariatric procedure in the world, with a long history of excellent outcomes. Studies have shown that on average, a patient who has a gastric bypass procedure will lose up to 75% of their excess weight. Most of that weight loss will occur in the first year. For the majority of patients, the weight that is lost stays off. The procedure is performed laparoscopically, which is a modern surgical technique with only small incisions. Smaller incisions result in less pain, shorter hospital stay, faster recovery, and reduced risks of infection. It takes about 90 minutes to perform, and you are in the hospital for 2 nights and recuperating close by for 3 more days. The gastric bypass has 2 parts. First, we divide the stomach into a smaller portion or pouch, which is about the size of an egg. The second part involves connecting the gastric pouch to the small intestine. This results in the majority of the stomach and a section of the small intestine being bypassed, meaning it is not involved in the digestion or absorption of the food you eat. The gastric bypass procedure works in 2 ways. One is that when you eat, the small pouch of stomach fills and sends an "I'm full" signal to the brain. Your brain thinks you've eaten a larger portion than you actually have, and you feel satisfied with this smaller portion. The second reason the gastric bypass is so effective is that in bypassing a section of the intestine, absorption of the food you do eat is reduced, and you therefore take in less calories. You can feel satisfied with smaller portions and last longer between meals. You'll be given a set of instructions on graduated eating to allow time for your operation to heal. It is very important you make healthy food choices, chew your food well, and eat slowly. Most patients can resume normal activities within a week to 10 days. If you have any further questions about the gastric sleeve, please let us know.